we'll get started. We've got some slides from myself and Rue. So as Olivia said, myself and Rue, we're working with NHS England and NHS Improvement. And part of our role is really to increase the number of health and justice placements there are for trainee pharmacists starting in 2023, 2024. So this is something that we've been working on since the start of the year. My background is my substantive post is a workforce development pharmacist at a trust in the northeast of England. So my job's dealing with foundation pharmacists, early careers pharmacists within the acute trust. So that's my background. Rue, do you want to jump in and introduce yourself?
Yeah, sure. Hey, everybody. I hope you can hear us clearly. As Dan said, my name is Rue. My background, initially, I've spent about 12 years within the health and justice world. Currently work with a acute team which looks to reduce hospital admissions and ensure we can treat patients in the community. So we do that 3 days of the week, and seconded in a role with NHS England and NHS Improvement for 2 days of the week with an acute eye on trying to promote the world of prison pharmacy. And we would like to take the opportunity of introducing trainee pharmacists to the world of prison pharmacy as an avenue, because I would love to know how many people would have actually known that something like that exists. Before I turned up, when I've qualified and went into work, I never knew this was a thing until I randomly landed there. So we'd like to make sure that everyone's aware that it's a great place to work at. And hopefully at the end of our talk show, you get a bit more of a feel of what that's like, and speak to the people that actually do it every day at this current moment in time. So thank you for joining us.
Cool. So yeah, me and Rue will cover a couple of things. So why are we trying to increase the number of prison placements of trainee pharmacists? What's it like when you're there? How can you find more information out, and where are these going to be? And then Laura and Emma are going to talk about their day jobs, what they actually really do, because they're the ones who are in the prisons at the moment, or Emma has been in the prison. So a lot of you may be aware that there's been changes to the education and training requirements by the GPHC for trainee pharmacists. So there was rebranding the names. So you're not called pre-regs anymore, you're called trainee pharmacists. It's called the foundation year instead of pre-registration training year. So subtle changes to names, but there's been changes in terms of what they expect trainees to be doing during the time there. So this involves a lot more leadership and a lot more based on clinical skills, but also an emphasis that trainees really have to be doing things and doing them to a high level to be signed off by their supervisors, and less so of watching other people do certain tasks and actually doing tasks for themselves. There's been some changes. And also there's been a huge increase in the number of pharmacists working in general practice, there's been a huge increase in the number of cross-sector training places there is for trainee pharmacists working in general practice as well. So that's come off the back that within general practice, you couldn't spend your whole training year within general practice, as there were certain competencies and learning outcomes that you couldn't cover. So you could only spend 6 months within general practice. However, they found out trainees that have done these cross-sector, so 6 months or 3 months in GP, and then the rest of their training either in community pharmacies or hospital trusts, they've actually found that training to be really beneficial and provide them with a more rounded training year, and helps prepare pharmacists or trainees to when they become pharmacists. So this is an idea that we've seen work really well, and we're doing a similar method within health and justice. So all the health and justice placements that will be on Oriel for 23-24 are cross-sector placements, and you will spend a 13-week period within a community pharmacy or a hospital trust. So that 13-week period allows you to do a cross-sector site. So you'll do 9 months or 6 months within one sector, and that will be hosted by a community pharmacy or hospital trust. So they're the person that will employ you. They're the person that pays your salary. They're the person that you have a contract of employment with. The 13-week period can be split up. It could be a 13-week block, so either the second or the third quarter, or what a lot of places do is they actually have split weeks. So trainees spend 2 or 3 days in one sector and then 2 or 3 days in the other sector. And that makes up for up to a period of 13 weeks. The 13-week period is quite a long time, but we really want to embed trainees into this new sector of pharmacy, or new training sector of pharmacy, for them to really be embedded into the team, so they know what it's like to work in the sector in the future. It also gives the pharmacists, so Laura, who we've got on the call as well today, an opportunity for them to act as designated supervisors, and for them to gain skills as well as for them. As I mentioned, trying to increase the number of cross-sector training sites. So this is something, when I was looking at the reforms education and training of pharmacists, there's a little quote that I've pulled out there from the GPHC, which really embeds what we're trying to do in this. Foundation training year will further expose trainee pharmacists to new situations and environments. It will give them opportunities to build upon their knowledge and skills and demonstrate these with patients and clinical settings. So that we know health and justice sites are very patient facing and are very clinical sites. People don't necessarily realize that. But what it is it's the idea is that you're building on skills that you've developed during your undergraduate year or within your host organization, and becoming an expert in these skills that you have, and having the opportunity to do these in different situations to build on them. So the example that we've been giving people is putting yourself, so when you're doing medicines reconciliation, the way that you do that in your hospital or within your community pharmacy is different to the way that you would do it in a health and justice site. And that involves the soft skills that you use when talking to patients, but also the resources that you'll use and the way that you document things are different. So it's building on those skills, put them together to really perfect them. So it was great when we got in contact with the BPSA about what we were doing and how we could get involved with them. And actually 2 of their policies from last year are very, very close to what we're doing here. The top one, the association believes that pharmacy students should be made more aware of opportunities to lead to non-traditional career paths. That's what we're hoping for here. And then secondly, the association believes that foundation training should provide multi-sectorial experience to effectively prepare students for professional practice. So again, that's what we're trying to do here. So I'll hand over to Rue for this bit.
So hi guys, just to start off by giving a bit of a demographic of the situation within prisons. So at this current moment in time in England alone, we have 118 prison establishments. Now, prison establishments are not just prisons. That can be a prison, or it can be a secure facilities for children and young people, or police and court liaisons, diversion services, immigration removal centers, and all of this together makes health and justice. So there are different areas and different practices and different ways of managing medicines in all of these individual places, and they're all slightly different in how they achieve that goal, which is safe use of medicine, prompt use of medicine, access of medicines to these patients who can't, like us right now, walk around, go to a shop, buy whatever they feel like, and all the other things. So how we ensure that that happens. At this current moment in time, in December, when we last checked, there were nearly 80,000 patients in the prison world. Yes, arguably, I'd say 20 to 30% of these patients probably are young, healthy, fit people who might not require any medical treatment. But nowadays, with the whole advent of DNA and how advanced that is getting, in the prison population, we are now getting more and more elderly patients, more and more polypharmacy, more and more drug misuse, and all of those issues that you now get to see in a hospital world or in a community pharmacy, they are counted regular basis within the prison world. So the type of services, like what happens within a prison, if that is a question, then the easiest way to respond to that is think of a prison as its own separate community. And as I mentioned, that the community needs to have the same level of access to healthcare as any one of us would in our communities that we live in. So a prisoner should have access to a primary care service, which basically means GP land. Every single prison has a GP practice embedded within a health and justice site. So in terms of what kind of stuff do GPs do? No different to any other GP practice. They are mapped to the same level of outcomes, but we get, CQC come and inspect the place. Everything is done the same. Certain health and justice sites also have a 24-hour inpatient unit, which is manned by nurses all the time. And that is for really, really unwell, acutely unwell patients. So they have a secondary care, like a hospital level system, which is available within a prison world. Substance misuse services. You get to learn all about methadone, buprenorphine. Now you've got the Buval patch, the Buval injections, and all the new advents and the new things that come across. And not to forget alcohol as one of the biggest substance misuse things that comes across, and how we treat those things. Mental health services, opticians, dentists. If you can think of a professional that's supposed to help the community, I guarantee you'll have the opportunity to meet with them and work closely with them within a health and justice sector. Sorry, the next slide, please, Dan. So as I mentioned already, the services are equivalent to those provided in community GP practices. So a lot of people might ask what a pharmacist does within the prison world. We are very fortunate that we've been able to get Laura to come in. So I'm not really going to go into a lot of detail over all of these activities that we are there, because I'm sure Laura will go through her day job and explain these things in more detail. But if I were to run an overview, majority of the prison sites or health and justice sites have an on-site pharmacy. So if you're a trainee pharmacist and thinking about, should I go into this world? You can think of it as a community pharmacy. All of your dispensing, clinically checking, and all these activities that happen in a shop, you would be doing that within the prison world. A lot of patients have mental health issues or develop mental health issues when they're within this environment. So you can imagine how important a pharmacist is in able to recommend treatments, identify patients, because we're in close contact with them on a daily basis, and make sure we're referring them to appropriate level of care so that they can get best outcomes out of their treatments. As mentioned, GP services are available. So all the things that a GP pharmacist does, per se, meds rec, reconciliation when they move between different establishments, or transfer of care pathways, running your own clinics. Do that all the time. Identify patients that are not compliant with their treatments, have a discussion about those activities, identify inappropriate treatments, drugs of misuse, and explaining to the patients safer, more alternative medicines that they can take, and working closely with the GPs to ensure that the medication supply is always there and patients don't go without their treatments. Spoke a bit around the drug and alcohol services and substance misuse. Dan already mentioned around the medicine reconciliation and the optimization level pathways. And as I said, literally everybody that you can think of works within a prison, and which is the best of everything, because you get the time to actually appreciate what other people do, how your work impacts their work and how their work impacts your work. And you have to all work together on the same level, singing of the same hymn sheet, to make sure that the patient is, at the end of the day, getting a patient-centered, holistic approach to the managing of their healthcare needs. Collaboration not only with healthcare professionals, but there are a multitude of non-healthcare professionals. Let's start off by saying the prison officers. You couldn't do anything without them. They're there to help you feel safe, make sure that they can grab all your patients for you. You have to liaise with them on a daily basis to maybe sometimes verify some of the stories that you might be hearing, to make sure that you can look after the patient. You have chaplaincy people that will help with the talking therapies, and if people are feeling a bit down, they can speak to the chaplaincy people. You've got Samaritans, talking services, counselors, you name it, it's literally in there. One of the biggest challenges a pharmacist faces within a prison world is about ensuring that our practice aims to reduce the risk that from harm that medicines cause. A good example of this is something which has affected all our lives. So if anybody was wondering how pregabalin became a CD, it stemmed from the prison world. There were a few deaths in custody. I'm talking 10 years ago, this is. So 10 years ago, when I was working at the HMP Bedford as a regular pharmacist, we were part of the national audit on pregabalin and gabapentin use. At that point, those drugs were not controlled drugs. And they was able to establish a link between the drug misuse world and using of gabapentin, which apparently promotes a bigger high. And then that went on to that. And now we have come to the conclusion of them having to be used as controlled drugs. So other classic examples, who would have thought Buscopan is a medicine that can be abused? When I was training as a pharmacist, I remember my community pharmacy, my trainer at the point would be like, oh yeah, patient's got tummy pain. Buscopan would do the trick and wouldn't even think twice about it being something dangerous because it's a P medicine. However, not in a prison world. You can crush it and smoke it. It becomes a hallucinogen and people get high everywhere, all across the place. And the risk is not just to them, but also to others that they pose when it comes to this. They also use misuse drugs, which illegal drugs. And then let's say a patient's on multiple drowsing medication and they've ended up taking more illegal substances on top. And how does that impact? And a pharmacist is key, being able to advise non-clinical staff and clinical staff in how to best manage the patient. And those are just some of the fun and amazing bits that you get to do, which you might not get an opportunity to feel that in other environments. Next slide, please, Dan. So in terms of roles and responsibilities, these are just broad spectrum activities, just supplementing what we've been talking about. So you are a part of a very important part of an MDT. You'll be literally a key stakeholder in your drug and therapeutics committees, your local medicines management committees, local clinical governance committees, and your voice carries a lot of weight. Oh, sometimes, sorry to stop, Gloria, yes. So does the highs from these, can they cause into violence? Yes, they can. However, for you to be in that situation where you're the one at the receiving end of the violence is highly unlikely, because there are certain rules when you work within prison environments. You'll be spending most of your time behind a locked gate, locked door, because you have access to medicines and we wouldn't want patients to come through to you. But you will get a phone call for advice. And it's about being smart. If all of the prisoners are out about walking around the landing, it might not be the brightest of ideas to carry around with a bag of drugs and walk straight through them. You know, common sense interventions. And your prison induction training is very comprehensive when you were to start to work within a prison establishment, where they literally tell you all the ins and all the outs, all the do's and the don'ts around working in a prison. As I said, I've been working in prisons for the last 12, 13 years. And till date, I have yet to have a violent altercation towards myself or to any of my team members that I've actually had an opportunity to witness. Yes, prison officers every now and again getting a little bit of a tiff, but I'm sure it takes two to tango. There are always other alternatives or other ways you can de-escalate most situations. And guys, please feel free to answer questions, ask questions as we're going along. More interactivities, the more useful it will be, and we can alleviate some of the fears or the concerns that people might have about this sector of work. So in terms of other jobs, so you'll be performing medication reviews for patients with long-term conditions, very similar to what a GP pharmacist would do. So if you think that is something that you'd like exposure to, a prison could do that. Managing specialist conditions like asthma, diabetes, hypertension, encouraging healthy lifestyles, making sure public health promotion activities are being encouraged, and you're leading the way in being able to ensure that these patients are receiving the same level of advice and everything else as everybody else does. That's part of our gig, and that's something that we need to be doing. Improving the safety around medicines. T-gel shampoo, that's another one. Who would have thought T-gel shampoo could be abused? But that's another medication that can be abused. And then you develop strategies and ways to ensure that you minimize the risk and improve the safety around medicines. There are other policies as well. I think Laura will probably speak about them later on in terms of the type of policies that we use within a prison environment, which are key, again, to ensure that we're improving safety. And as I said, it's around access of medicines to these patients, making sure they're not going without. And we will be assessing conditions and delivering frontline healthcare interventions. So within a prison environment, you've got to think of it as like a mini hospital. Your patients are not running away. So you actually have wards, but instead of me having 20 people on my ward, I'll probably end up having 120 people on our ward. So you have like a mini dispensary on each of these wards. And at those places, you'll have options of over-the-counter medicines that you can actually assess the patient and then make sure, recommend them and actually provide them with these treatments. So that's another thing that you can do. Could these drugs cause addiction? Depends on what drug it is, depends on what their level of abuse is. At the end of the day, most medicines can be addictive, either could be via placebo effect that they have, or could be via the actual addiction pathways that they have, like the zopiclones and the other controlled substances that we have within our arsenal. Next slide, please, Dan. So these are just some of the people of your multidisciplinary team. If I wanted to, I can probably carry on and actually add another set of the same amount of there. But first and foremost, your patients or prisoners, biggest part of your multidisciplinary team, because they're your focus. And you'll have, for me, as I said, I've worked with nurses, paramedics, GPs, psychiatrists, primary mental health care teams, secondary mental health care teams, substance misuse teams. You have dentists, opticians, admin staff. You won't realize how important they are. They're most important people within the prison world to making sure your communications are going in the right way, your transfer of care is covered, making sure when people are coming in, you can get access to the right level of information and so that you can decide on the level of care. Dispensers, pharmacy technicians, prison officers, and as I said, the list goes on. Next slide, please.
Cool. So these are some of the things. So we've been going around speaking to quite a lot of the universities already, and speaking to students and just getting them to fill in forms and find out what their concerns or issues they might have. So these are some of the things that I just want to point out to you and sort of alleviate some of those. So location and transport, we know trainees want to do placements in whatever's suitable for them, as there aren't as many prisons as there are hospitals, community pharmacies or GP practices, and this is the start of these sort of placements. Obviously there is a fewer number of them, so geography may be a problem for people. We're aware of that, but what we would say is, if on Oriel, only make sure that you preference something if you really do feel that you would be able to travel there. People's lack of information regarding these opportunities, I guess that's why we're here tonight, to try and raise the profile of these in anticipation of you doing your Oriel applications in the summer. And people were talking about how competitive it might be to get onto these placements. Don't worry about that. If it's something that you want to do and you're willing to travel there, it's local to you, please preference it. If you don't preference it, you're definitely not going to get it. If you're willing to do it, if you don't put your name in the hat, it's not going to happen. And people are obviously curious about how and what the experience would be like within the sector. So I guess that's why we've got Laura to come along and speak to you and tell you, and Amar to tell you what it was actually like for them in the prison. And this is another thing that came up quite a bit, scared of the prisoners and safety in the workplace. So I guess Rue's already mentioned about that, but it's actually working in a hospital, working in an A&E department or an elderly care ward where you've got delirious patients is actually potentially more dangerous than it would be going into a prison site.
Sorry, Dan, can I just interrupt Marta's question here about the salary after registration compared to community and hospital? So Marta, the way prisons are governed and structured, there are some prisons are run by NHS services, some prisons are run by private organizations. So if you're managed by, let's say, an NHS service, again, within a prison pharmacy, there are different levels of pharmacists. You might be a pharmacy manager, which might be like a band 8 or a band 7 to start off with, or you might be like a area manager because a trust might have 2 or 3 prisons. So you might be a lead for all of their prisons within the area and making sure they're compliant. That could be an 8B or up to an 8C. In terms of if you're working for private organizations, then unfortunately, I really don't know because I haven't worked for one yet, but you just have to look it up. But I think the pay scales are very much similar to band 7s. And because not a lot of people know about Prison World, and it does take some time once you, let's say you apply for a place, you then get a place to go in. It will take you a month and a half to get your clearances sorted out, making sure you have access to the prisons. But the good thing is once you get cleared, you're cleared nationally. So you can then walk into any prison in the whole country without a problem. So it's like a little bit of pain at the start off to get on with. The forms are humongous. The checks are strenuous. You can imagine only but why this is a secure unit. You know, the Queen's got a face put on her name written on the front of the prisons, but if she rocked up to a prison, she's not getting in. You know, it's one of those places, literally, you need all sorts of clearances to be able to work in one. But the salary is pretty decent. As I said, my first ever full-time job that I took on after becoming a pharmacist was straight into the prison world. I did 3 years of locuming in different places, different jobs, but the day I went into the prison world, didn't want to leave, and I'm still there 12 years on.
Cool.
Sorry, Dan.
No, it's all right. I hope you'll have been looking at the map that we got on here. So this is a list of all the prison sites in England that will have a health and justice placement on Oriel for 23-24. So they're all kind of spread out across the country. Each region has a site. So we do hope we've managed to reach everyone. In your region, there should be at least 1, if not 2. And you can see some of them are partnered either with community pharmacies, some are mental health, a couple of mental health trusts, but the majority of them are acute trusts. Some of the more rural sites are linked up with community pharmacies because there isn't always a hospital trust near enough to them. But these are all the ones, and you should be able to find all of these on Oriel. So hopefully you should have had access to Oriel already, and if you should be able to look on there. If you have a play around, you should be able to see all the Oriel and all the health and justice sites on Oriel. They are all under HMP. They all have the postcode of the health and justice site and the host organization on there. So I do recommend having a look at where these sites are, how close they are from you, is the distance to travel okay. And some of the health and justice sites, you do need a car to get to them. So that will be in the description as well. So if you don't have a car and it says you need a car to get to that site, it's probably not for you, because there aren't always public transport links. That's not for all of them. You know, some prisons are in city centres, but some are in more rural sites. So please bear that in consideration when you're looking at them. If you want any more information on the Oriel sites, either contact me or Rue. So I'm covering the North and the Midlands. Rue's covering the South and London. So get in touch with us and we can either direct you to other people or give you more information. On Oriel, there's only a finite information that you can include in there. Or if you want to speak to someone, the pharmacist that's in the site before you put your preference at one, just let us know.
To alleviate, I was going to say that to alleviate some of the concerns around the location and the barriers with traveling, while me and Dan were trying to organize these placements and put them through Oriel, we have tried incredibly hard to make sure that the places that we have linked up the prisons with are in the same locality. So I would say no more than a 5 or a 10 mile radius between the host site and the prison site. So again, we understood the concept of you can't have your host in London and the prisons in Manchester, for example. It's just not going to work out that way. So we have made sure that geographically, the prisons are linked up with local or very local host sites.
Yeah, completely. I agree with Rue. We did put a lot of time and effort making sure that the sites are geographically suited. We spent a lot of time ensuring that the sites, because this is all new to the prison world majority, made sure the sites have enough room for a trainee. Is the pharmacist on site adequately? Have they been qualified long enough to reach the GPHC standards or to act as a designated supervisor? So we did put a lot of effort and time into speaking to people. If you wouldn't mind, there's a little survey that when we're speaking to prospective students, just to fill in via that QR code. That would be great. It should only take 2 minutes. And that's the end of what me and Rue have to say. Unless you've got anything else, we'll take any questions if there's any more, or we would hand over to Laura so she can talk about what it's really like to be in a prison, how she got there, and all this other stuff. Exciting stuff she's gonna talk about.
Brill. I don't think there's any questions there. Right, now I'm going to attempt this. So good evening, everybody. I'm Laura. I am a prison pharmacist. I'm just going to share my screen now so you can see my lovely PowerPoint. Right, so I'm hoping that you can see all that now. Right, can somebody just give me a thumbs up that they definitely can see that and I'm sharing it correctly?
All good.
Perfect, wonderful, wonderful, wonderful. Well, good evening, everybody. Like I said, I'm Laura Willey. I'm a lead clinical pharmacist and I cover 2 sites. So I look after HMP Newhall, which is one of the fabulous locations for our new foundation trainee pharmacist post. And I also look after HMP Askham Grange. So I'm going to go through like just everything. Dan's given me like 4 pointers, which I've tried to squeeze onto 10 slides. I love to talk and I have a huge tendency to go off at a tangent. So if anybody wants to rein me back in, please feel free. If you've got any questions, please just keep putting them in the chat. I also want to try and alleviate some of the concerns, some of those ones that people have popped on for the forms that are sent back to Dan and Rue. You know, I absolutely love my job and I would echo what Rue said. Once you get into prison pharmacy, there's just nothing else quite like it, and I would never go anywhere else now. So it's I'll just tell you a little bit about how I ended up here, because it is one of these it's like a secret club that once you're in it, and we just want to spread the word really to make sure that more people know about it. So we're going to look at my journey of health and justice, how I ended up here. What I absolutely love the most about working in health and justice. I'm going to do an example of a typically unique day as working as a pharmacist in health and justice. Genuinely, when I tell you that no 2 days are ever the same, I absolutely would put my house on that, because there literally is no 2 days are ever the same in the prison setting. And you know, I've done hospital, I've done community, and you know, sometimes it can get a little bit Groundhog Day. Absolutely not in the prison. From the moment I walk through those gates in the morning, it's just, what is going to happen today? What is going to happen today? And it's just, yeah, you can never predict it. And I think people want to know about what the potential is, what things you can do, like if you want to excel your career, if you want to climb the ladder, what are the courses you can do. So I'm going to go through a little bit of that as well. I did want to say that obviously I work for Practice Plus Group. It is a private company that I work for, so we run NHS services within the prison setting. We have a lot of prison settings, so obviously I'm quite well versed in, and I would say that the salary is very competitive in private sector. So please don't let that put you off. We run NHS services, but it's not an NHS contract, but please don't let that be a barrier to you applying either. So my journey so far, so I know I don't look a day over 27. However, my career path to pharmacy was a little bit unusual. I worked in public health for 10 years as a specialist advisor in substance misuse and smoking cessation prior to training as a pharmacist. So I basically left college full fresh and just went straight into the world of work. So I spent 10 years working in substance misuse, working with the most vulnerable groups in society, groups in my community, and actually ended up looking after the secure sites across Wakefield for substance misuse and smoking cessation. Now, many moons ago, it was absolutely fine to smoke within the prisons, and obviously all the prisoners smoked, and it was they had a very high proportion of smokers in there. At the time, out in the general community, we were doing the massive push. So we'd gone smoke free. We got these smoke free areas. You couldn't smoke in pubs anymore. So that drove a big change for the prisons as well, because like Rue said, we are in the prisons to echo the same as what there is in the community. There is no discrepancy, there's no difference with that. If it's a health initiative in the community, it's one we should be driving in the prisons as well. So before the prisons went sort of smoke free, almost enforced, they actually put us in as advisors to get as many prisoners to stop smoking as possible. So I used to go into H&P Wakefield, which is a Cat A high secure prison, and I also worked at H&P Newhall, which is obviously where I am now. Two very different sites. H&P Wakefield is male estate, a capacity of about 700 prisoners. We used to run group sessions there, and they used to work really well. We used to do group sessions of about 25 prisoners. They were absolutely brilliant. We used to do an 8-week course. At Newhall, nature of females, sometimes unfortunately we weren't able to run group work with them because it tended to cause too many issues. So we used to do one-to-ones with those. So obviously we were in that environment, and I used to work, one-on-one with the prisoners and used to facilitate the groups, and it was just fantastic. And it was there that I actually met the pharmacist, who's actually my regional lead now. And she was like, why don't you go back and retrain? And fortunately, I'd done all the groundwork previously. It just wasn't the right time to go. And I did. So I packed my little girl off to nursery when she was 4, and I went back to uni, and I trained at Bradford Uni. I did a 5-year split rotation. So again, I can't echo how important it is for you on your pre-reg year. You need to be exposed to us as much as we possibly can, to make sure that when you come out at the end of that 12-month trainee program, that you are absolutely ready for whatever the world is going to throw at you. We can put you straight into a dispensary in a hospital, in the community. You can come and work with me in the prisons, and you are going to be absolutely prepared for that. So I did 6 months at Boots, which was a big store in Wakefield, and then I did 6 months at Pinderfields Hospital. And I actually did my final 6 months was at Pinderfields, and that's how I ended up staying there. So I stayed there as a foundation pharmacist, and then went through into specialist rotations, and really enjoyed aseptics and acute medicine there. So that's where my background was. So I was there during the first wave of COVID, and I did the first wave of COVID in the hospital, and obviously that was really challenging. It was really hard for absolutely everybody. The hospital was just, the teams were just phenomenal. It was absolutely unbelievable. But the opportunity actually came up then in May 2020 for the lead prison pharmacist at Newhall and Askham Grange. So I grabbed that opportunity with both hands, and as Rue says, I applied in May, but then your clearance and everything takes about, can take up to 3 months at times. So then August 2020, landed at Newhall as their lead clinical pharmacist, with oversight over Askham Grange as well. So, and I've been there ever since, and it's a joy, and I absolutely love it. So these are my 2 prisons. So the top one is Newhall. Newhall, we have a capacity of up to 450 prisoners. We are classed as a closed prison. So it's worth noting that female estate is, obviously there's less of them in the country. So we will have a variety of prisoners within our prison setting. So you will have sort of what would you class, your male estate would be classed as your category A's, your restricted status prisoners, but we'll also have prisoners that are just on remand. So we are a remand site as well, which means there's a lot of movement, people arriving, people getting released, people only with us for a very short period of time. And obviously that can impact on how we then actually how they enter the healthcare system with us, what we can do with them whilst they're with us. And obviously that's just part and parcel of what you go to work for every day. So it's all completely different. We have a large pharmacy on site, so the foundation training, the students that's going to come with me, we've got a great pharmacy team, we've got a large pharmacy team, we push out a lot of meds. So some of my other local prisons, such as H&P Leeds, H&P Wakefield, their capacity is double mine. Leeds is up to 1,000 prisoners, Wakefield, like I said before, is about 750, but we push out as many meds because my patients like medication, and we do a lot of changes with meds while people are in with us. And like Rue said before as well, you know, unfortunately they're not all young and fit and healthy anymore. My eldest prisoner is 83, my youngest has just turned 18 and has just arrived with us. So you can imagine that breadth of age comes with all the comorbidities that come with that. So, you know, we're managing a lot of long-term conditions, so you're absolutely going to see all that whilst you're with me. And you're managing acute stuff as well, so it is really, really interesting. H&P Askham Grange is actually Askham Richard in York, so this isn't a site that you'll be travelling to. H&P New Hall's in Wakefield. H&P Askham Grange is an open prison that's actually in Askham Richard, which is near York. It's a stunning prison. It's a big old stately home, and that's an open prison. So my patients there will go out on what's called rottle, which is released on temporary license. So a lot of them will hold down jobs, they'll see family, and it's all part and parcel of the rehabilitation work that we do with that. Now, obviously, there's the opportunity. I go there usually once a week, 2 or 3 times a month is when I've got double cover. And obviously, I'd love to take, if anybody wants to come, and if people want to see that whilst they're on, you know, on their placement with me, that is absolutely fine, because it's a whole different ball game there, because we're getting them ready for release to community. So it's a slightly different ethos over there. Obviously, we're mirroring everything they can do in the community, but for a lot of them, they can actually access community services as well, because it is an open prison. So they don't have a pharmacy on site, but I, as the responsible pharmacist for New Hall, I am responsible for those as well. And we actually act as a hub and spoke model. So we actually dispense all of Askham's meds for them, and then that gets transported across. It is a smaller healthcare team there, but equally as fabulous as mine. And like Rue said, you want to work with a mental health team, you want to work with a psychiatrist, you want to do some work with a substance misuse team, you want to work with an optician, you need to be in the prison, because we have everything. Whoever you want to work with, whatever you want to shadow, we absolutely can fully facilitate that, because we are, like Ruth said, a little mini community, and we are fully self-sufficient behind those gates. The aim of the game is to keep our patients well and keep them within the prison. Obviously, there's a massive cost implication if we need to send people out to hospital, so we need to keep them as well as possible whilst they're with us. So I mean, I've tried to pull some bits off my job description. What do we do? I mean, it's literally the sky's the limit, because you've got so much movement on what you want to do in health and justice. You want to do a project. They're so accommodating and so inspiring that you know we're just about to start a menopause pathway for my patients, and one of our nurses has actually been on the Davina McCaw program. You know, it's absolutely, you literally can do, you want to do some really good meds management, do some really good implementation of pathways. You've absolutely got the cohort of people there to do it, and the support of the healthcare team to be able to carry it out as well. We always say that providing healthcare within sort of a prison setting, you've almost got to get the nice guidelines, read them, scrunch them up, throw them away, flip them on the head, and then that's how we deliver healthcare within the prison setting. We sometimes have to think outside the box, because you are providing healthcare within a prison regime. So, you know, we can't just nip a prisoner over to see him. We can't just do that, because we're governed by the regime. But it's all part and parcel of what makes the job so unique, and so fascinating as well. You are part of the senior management team, so I'm responsible for the full pharmacist team. So I've got a team of about 15 people, and obviously you're managing all that as well. So if you're interested in management as well, there's loads of scope to develop your management skills whilst you're in the prison service as well. We like to create guidelines and pathways specific for health and justice. Like I say, quite often it's quite hard to stick the nice guidelines and crowbar them into our prison settings. So we'll use them as a guideline, but we'll quite often create our own to make sure that across all sites, not just mine, that we are all working to the same guidelines and sharing good practice. So it is absolutely brilliant. We've just recently linked up with all the Practice Plus Group female estates, as myself at Newhall, Hascombe Grange. We're now looking after Drake Hall and Foston Hall as well, which are down south. They don't have an on-site pharmacist, so it's really nice actually now, because I'm able to share my knowledge and some of my pathways that we've created for my patients with them, to be able to get them to roll some of the good work out that we've done as well. We're obviously part of a big regional team. We meet once a month, and they're like your go-to basically. So it's a really nice family community for pharmacists. You've got a lot of support from the regional team and a lot of support from your fellow pharmacists as well, which is really nice. And I know I like that. Obviously, I worked in Pinderfields, there was 90 odd pharmacists there, but it can feel quite isolating at times. And I would definitely say that being part of the healthcare team at Newhall, you know, you're absolutely such a key part of it. It's lovely. You do feel like you're part of a much bigger family, which is lovely. So a typically unique day. So I've tried to make sure I've squeezed, like, this actually was like last Wednesday's. This was last Wednesday's work, was this. So when I was thinking about this, I was like, try not to crowbar too much in. It needs to be a genuine day. So this is my day. One of the nice things about my shift pattern is there is no weekend working. Our pharmacy is not contracted to be open on a weekend, so I work Monday to Friday. I usually do 8-4, half 8-4. Some days I'll have to do 7:30 till 9, depending on what's gone on that day or what needs to happen. But you know, you absolutely don't mind. You just put the graft in when you need to, and if you've got big projects that need to be delivered, then we've got big projects that need to be delivered, so you just need to get that extra work in. And some days you can end up with curveballs. That means that you've like not managed to do what doesn't feel like much work at all, and then you know you feel like you're on a bit of a back foot. So usually in the morning when I come in, I'll usually go and do a bit of a wing walk just to check the dispensaries. So I think it's worth pointing out that your pharmacy techs in the prisons are just next level. They're amazing. So we don't have nurse administration of meds at my prison. It's all done by pharmacy techs, and they are superb. They're brilliant. So I'll usually go on the morning. I'll just do the wing walks. I'll just go to usually just 2 wings. We've got 5 at Newhall. Just go pick a couple, just go and check in on them, just check there was nothing from handover in the morning, and just check that all the techs are all right. Obviously doing that, usually you expose yourself then, because there's usually obviously prisons are milling around. They're like, miss. I'm like, not right now. We're just there to just check on everybody else, just get all the meds out. We then have a morning meeting. This is prison led, so this happens every morning, and basically they go through what's happened the day before. So if you're allocated to the morning meeting as part of the senior management team, quite often you'll have some key bits that you may need to take away, some bits and pieces that you might need to go and investigate. So obviously we've just coming out of the pandemic now, and obviously being in a prison setting, it's almost like being in a care home setting really. Once COVID's in there, it spreads like wildfire. So quite up until very recently, our morning meetings were really about managing outbreaks, making sure that everybody was clinically well. Were the prison happy what we were doing? Were we happy with what the prison was doing? And you know, sometimes you can come, you know, loggerheads really, because obviously our motivation is that we need to keep these patients well, and we need to make sure we're managing their healthcare needs. And the prisons is that they're part of the discipline team, so they are there to manage the regime and make sure that everybody follows the rules. So sometimes we need to do a little bit of negotiating to make sure that everybody's outcomes are achieved. I'll log on at 9, so that's into System 1. At our prison, we use System 1 for absolutely everything. So a lot of people don't. System 1's actually got a lot of uses. We didn't use much of it in the hospital. Everything was a very different to System 1, but we use System 1 for everything at my site. So CCing is clinically, and the beauty of clinically in the prison is you have everything there, all the information. When they've been in with you a bit, you know what they're on. You can see previous prescriptions, you can see blood results, you can see it's fantastic. You've literally got the world at your fingertips really. Blood results, the whole kit and caboodle. What is tricky is when the patients first arrive with us, and that's when you are almost a bit blind really sometimes, because you are potentially going to be clinically in stuff that's the patient's not linked through to System 1. So at the minute we've just got a name, date of birth, prison number, and they're telling you whether they're on a boatload of meds, and obviously it's whether those meds are prescribed, not prescribed, managing all such as that. So there is a big difference. Sometimes there'll be loads of information, sometimes there might be none. But it just takes time for the system to link through. And obviously that's part of my job, and part of the tech's job as well, is to make sure that we make those links with the community GP and say, right, what are they on and why are they on it? Takes me on quite nicely to the Safe Prescribing Committee. So I lead this. We've, again, as Rue's already spoke about, the pregabalin gabapentin. Obviously he's now a CD due to the dangers, the illicit drug use with it, and also the misuse of prescribed medication when it was more freely available. We still have a big problem with it, massive problem. So we've had a huge drive in the last 12 months to massively reduce the amount of people that we've got on it. Luckily the NICE guidance came out in April 2021, and that actually really helped us, actually, which doesn't usually happen like that, but massively changed the way that chronic pain's managed, which was brilliant for us, and obviously made our life a little bit easier within the prison system. So most people are on like a TCA now, which is much more effective, and I can see that because I can see that in my patients that we've switched. But obviously it's managing that. So the Safe Prescribing Committee, we have every month I get a prescribing dashboard, and the University of Manchester, we are doing some patient safety indicators, of which there are 7, and there's loads of different elements to that. Some of it's as simple as, are they on a PPI if they're on a DOAC and a SSRI? It's as simple as that. That's one of the safety indicators. But some of the other ones are a bit more complicated around opioid prescribing, gabapentinoid prescribing, people that are on both, people that are on that and methadone. So it's about drawing out those numbers to make prisons more accountable for the prescribing, which is absolutely what should happen. The nice thing at Newall is the book does stop with pharmacy, and that is what I absolutely love about my job. Is if the GPs want to prescribe it, the psychiatrist wants to prescribe it, it has to come through pharmacy first, and we are not afraid to say no. I'm not afraid to say no. So if we think there's a genuine reason why there's an alternative that's available, or we've got intel that there's an issue on the wing, then that is the good thing. We are almost like the gatekeeper to those meds, which is how it should be. That is what we've trained for. That is our job as a pharmacist. We are the last point of call before those meds get to that patient. So, and the Safe Prescribing Committee has really drawn that out. So it's a brilliant committee to chair. So then we've already spoke about a bit about, Rue mentioned about methadone, buprenorphine and Buvidal, which is the newest buprenorphine subcut injection that's long acting. So we are pushing that now within our settings at both sites. So the teams call, usually I'll link in with my senior nurse at Askham Grange to check that everything's going okay over there. Is she having any issues? What are the meds or everything okay that we've sent over the last week before? And we just go through a bit of a review of patients. So what are we doing with patients over there, particularly the Buvidal patients at the moment? That's the big drive we've got. How are they doing? We're switching them from methadone or buprenorphine straight into Buvidal, and how are they doing, and reviewing the other patients. So if I can't do it face to face, I do it on Teams with my Linda. So our GP, she's outstanding. You'll learn so much from her. She's just absolutely wonderful. So she usually bobs in at dinner time, and we just review who she's seen in the morning, which is nice. And then that gives us a chance to negotiate some prescribing, what she's thinking about doing, what intel have I got, what information have I had from the community GPs. We have a handover at 1, and that basically is where the entire team gets together, and then they come and tell me about what's crazy things have been happening on the wings, what's the latest thing that everybody's been asking for at the hatch. So like Rue's already mentioned, the pharmacy techs, they have minor ailments, so they can give out paracetamol, brufen, they can give out acyclovir. We've got everything on there. A bit of ishbagula husk if you're a bit constipated. We've got everything on there. However, we have to monitor what they take. So at Christmas time, they all like Gaviscon, because Gaviscon's part of the activator for how they make hooch on the wings. So we've got to monitor that. Cetirizine is the newest one that's just had to be actually taken off minor ailments because it was found to be an activator for spice. So, we've got to keep ahead of all these trends. They're very ingenious, really. They create all sorts of things with very regular meds. So like we said before, the Buscopan, until you've been in prisons, we don't prescribe it. That Buscopan does not enter my prison knowingly. It's just not prescribed because, again, like Rue said, they just yeah, they found that actually you can crush it, snort it, smoke it. It's
I think I learned more about pharmacy from them than I
yeah,
did at uni.
yeah, exactly. I always think you should channel, if we just channeled that energy into something else, maybe we'd have another, I think we'd have another Elon Musk probably sat in one of these prisons. Yeah, so handover, they tell us what's been going on in the morning, and then we sometimes then have that opportunity then to delve a little bit deeper into what some of our complex patients. So obviously patients that we have, they are complex. You know, the majority of them are you know, very regular. There's not really anything, you know, a bit of substance misuse, we need to monitor that. They may have asthma, a bit of blood pressure, but then we have the really complicated ones, and it's either polypharmacy, multiple comorbidities, extreme mental health. They're either in crisis or they're having a really low ebb, so we just need to review them. And that is very much an MDT meeting, which is just in the truest sense of the word. When I think about MDT, you wouldn't see a better example of it than what we see at our prison, because everybody's there and everybody is putting their part in, and we're really just creating a really, really good plan for our really complex patients. I'll then go back to pharmacy, and then we have like the mad hour and a half, because in all this time whilst I've been in and out mooching around, my super team of dispensers have been creating what can all be described as a wall of checking. So I'm really lucky I've got ACTs, but sometimes if they're on the wing or if they've had to do other jobs, usually from me, then obviously we've got all the checking to do as well. So we've got a good team, so that everybody just chips in. It's absolutely brilliant. The wing techs come to collect the medication, and then I hand over any important information. So all the counselling points, all this sharing of information about medication, that all gets relayed to the techs, and then they can share that with the patient. If we know we're concerned about somebody, or we're worried that somebody might have been bullied on the wing, then they'll coordinate their meds round to ensure that all that's encompassing. So nobody's going to be compromised with the medication, and that, you know, absolutely safety is absolutely paramount. Yeah, 3:45 we usually have a nice deep breath, and probably like my 20th cup of tea of the day, because that's also another really, really important part of prison pharmacy. We work better fully hydrated. And then usually at that bit, it's emails, checking on everybody else, checking other sites, and just continuing to clinical to the end of the day. One of the other things I'm doing at the moment, I'm just about to finish I'm a bit late again with independent prescribers, so I'm just about to finish mine now, but I'll then stay back. My prescribing I did in substance misuse, so I'm going to be part of the receptions team for when people first come in. So some of my days may be a little bit longer now, so from 5 we'll be seeing the patients that are being recepted into reception, and that's when they're in the acute withdrawal potentially, can be quite unwell, also can be a little bit more unpredictable, but again, just like I said, no 2 days are ever the same. So what I love about my job, apart from absolutely everything, genuinely, my patients, we're there to look after them. It's completely non-judgmental. They're my patients. What they come to me with is conditions, medications, and I'm there to make sure that we keep them super safe, and that by the time they actually leave me, they're actually in a far better place health-wise, holistically, you know, everything about them. They're feeling better about everything and feeling able to go out back out into community, having had a really good experience during the time whilst they've been with us, and actually we've managed to make some really, really good interventions as well. It's fast paced. Your feet don't touch the floor from the moment you set your foot in the gate, which is what I like. I like utter chaos and straight, you know, in from the moment you arrive. You're on the go all the time. It's absolutely brilliant. My team, not only the pharmacy team, but the wider healthcare team, the clinical knowledge that we hold within that, you know, I always think this behind those prison gates is just phenomenal. You'll learn so much. Every day I learn something, and there's just so much opportunity for sharing information, sharing experiences, pushing yourself. So future opportunities, I mean, literally the world is your oyster, you know, within our setting, because it's such an unusual setting. Most stuff, you know, if you want to do it, we'll find a way for you to be able to do it. We're doing clinical pharmacy techs now, so they're doing News 2 scores, they're doing clinical ops on the wings. You know, we're really upskilling absolutely everybody. It's great. Clinically progressive, you know, like I said, we do nice guidance underpins absolutely everything we do, but we also think outside the box, and it's nice to know that actually we're thinking outside the box, and eventually that box sometimes becomes nice guidance. So we do feed into nice guidance as well. We've done a lot of work around the Bovidal because we've been one of the biggest sites that's been trialing it. So we fed all that information back into nice, which is great. And professional recognition. I feel like a pharmacist. I knew what I was getting myself into when I came back to retrain. So I remember being at uni and people were saying, I don't know why you're doing it. You want to go do something else. I'm like, no, I want to be a pharmacist. And I am a pharmacist, and I am so proud to be a pharmacist. I'm even more proud to be a prison pharmacist because it's just so unique and so diverse and so clinically satisfying. You're just learning so much all the time. This is an artist's impression of how much I love my job. So this is my dog. Other pupchinos are available, but this is I feel like this is just how much I love my job there. Right there in that picture is how much I love my job. And this is Amber, my little fur baby. So what does the future hold for you if you want to come to prison pharmacy? Anything, independent prescribing, Royal College of General Practitioners, stage 1, stage 2, lots of professional qualification in substance misuse. You can do your IMS and VAC. So I'm part of we lead on the Kovid vaccinations at our site. I go out and do them. The techs go out and do them with me. We go to other sites and do them. It's absolutely wonderful. Regional role, but not limited to pharmacy. So I've got pharmacist friends that have gone in as head of clinical governance. We've got deputy head of healthcare. We've got head of healthcare. We've got pharmacists that now sit on the drug strat team for the prison. It just opens so many doors into this, like I said, this secret club that nobody knows about. No matter how much we shout about it, it just hopefully now having the training placement really is going to hopefully raise the game and get you interested and make you want to come and work with us. And hopefully there might be some more prison pharmacists sat there right now. You just don't know it yet, which should be super. So has anybody got any questions? Sorry, I know I've rattled on. I'm very conscious about that, but I just get very enthralled when I start talking about about my day and my prisons.
Laura, there was one in the chat.
Sorry.
So, no, it's all right. I think Rue half answered it, but they were asking what was your experience of COVID in the prison, and how did that affect your job?
Horrible, switched everything upside down overnight.
Yeah. Literally flip it on its head and start again. Yeah, so obviously for us it was you're delivering the same service that you're getting on the outside. So basically at one point we had an entire wing shut down, which meant there was 120 women behind the door. Those women, half of them were on methadone. And there must have been, on a morning meds round, there's usually 96 women to med on that wing and they were door to door. So it was everything, because then what comes into play is not so much, it's not your clinical side of it, it's actually the coordination and the legal side of it. So obviously we were making sure that we weren't doing secondary dispensing, that everything was being administered according to the law and the guidance and the SOPs. So that was it was crazy, because obviously that went on for the best part of 12 weeks. We had a wing lockdown at a time because it just, as I said, it spread through it. But it's been hard. It's affected the prisoners because they've been locked behind the doors for 23 hours a day. We're only just back into normal regime now, and that happened about 4 weeks ago. So it has been really challenging. Clinically, we've had a lot more people. We talk about people with asthma and COPD, but there's another element to it. We've got a lot of crack smokers. They come in and they are very fragile, so their respiratory systems are also very fragile. It's not necessarily it's not a asthma, and it's probably an undiagnosed COPD, but there's this element of women that were very vulnerable and could end up being quite poorly from it. So it was a massive challenge. We have come out the other side of it now, but like I said, we actually won as a site best practice. What we did during our lockdown has been shared with other sites as the gold standard, because the patient safety, the administration of medications, ensuring medications were getting to our prisoners was absolutely spot on.
And I would like to add, like, that all of that is actually the easy bit. The more difficult bit was, I would say, when you talk to these guys, conflict resolution, you got to remember, right? At the end of the day, their room is no bigger than most people's single bedroom room that you have in your house. In that single bed that you have, imagine they've managed to fit in a table, 2 lockers, a toilet, a sink, double bunk bed, and a window, probably the size of an iPad, that doesn't open longer than about 3 millimeters. And you have now put both of those people in that room for 24 hours a day, locked up. If you imagine what your room might smell like, what it feels like, when it's warm, it's warm. When it's cold, it's absolutely freezing. And at that point, you're their saving grace, because that's the only time their door opens, because the meds people are around.
Yeah.
So it's all your people skills, I would say, are the most important things if you want to be a prison pharmacist. If you've got poor people skills, guys, just stay away, because you will hate it.
We've got to sell them when we're trying to negotiate with them, when we're stopping meds or doing reductions. You've got to sell them the dream of the other side. Absolutely.
Got a question there. Can male pharmacists work at a women's prison?
Oh, absolutely. Yeah, absolutely.
But trust, I don't think I could work in a female prison, but I'll be honest with you. I've been to one that was like, nah, not for me.
Yeah, absolutely.
It takes special people to work in prisons, guys. Let me tell you that right now. It's not for everyone. It does take a good 3 to 6 months to adjust to the life, because all of a sudden, even your dignity and privacy and all of that's gone. You can't walk around the building like, anyhow. Doors are locked everywhere. You do feel locked up in a thing, and it does take 3 to 6 months to adjust to the new environment. But as Laura said, and I would completely agree, once you adjust, there's no going back, because you've literally found yourself everything a hospital does, everything a community pharmacy does, and no rules. Go crazy. If it's something worth doing, nobody's going to stop you from doing it. No one, literally.
I know we've got Amar on the call, and he's been sitting there very patiently for the last hour, probably talking about what we already know. So I'm just going to, Amar, if you don't mind, putting your camera and your thing on, and I'll ask you a couple of questions about your year. I know I've already asked you these before, but it'd be quite good to experience with people who are thinking about it. So I think safety is a big thing. So how did you find it being a trainee? Because you were from a mental health trust going into the prison, and how did it feel when you first went in?
I think initially it was a bit of a learning curve. But luckily, because I'm coming from a mental health trust, I'd already had some experience with forensic wards. So you get used to the whole lock every door as you go in, make sure everything's there's no phones in your pockets and that kind of stuff. But it did take some getting used to. So I don't know how it would be for other people. For example, for the prison I was at, it was an open prison. So you'd literally park your car, and in the car park, this prison's walking by about 20 meters away. And then on your first day, you do feel a bit shocked, but you do get used to it.
Cool. And I know you've told me already what you mainly covered, and you said you got loads of your learning outcomes done in the prison, the majority of them done. But could you just kind of give a background of what you did and what you got signed off, and what you found really beneficial about being in the prison?
Yeah, so initially I was going into the prison to mostly complete my dispensing and checking competencies, and my CD competencies as well. But I picked up quite a lot. So I picked up a lot of my physical health obs, a lot of my teamwork related ones, because I was part of MCCs, where we get to discuss clinical cases, and MDTs every day. And it's really good because you get to be part of the whole MDT. So I got to spend some time with nurses, with the GP, which I think when I talked to other people at my trust who didn't get that placement, it's kind of one thing I did that they wish they did.
Yeah, and you were definitely in an advantage when you went back to your trust. You had lots of skills and attributes that other people wouldn't have got, and some of them were softer skills, as you said, which are really important, but also how to speak to these people and some of the harder skills. So if anyone's got any questions for Amar, as he's the only trainee in the moment who has been in a prison this year,
ever.
pop them in the chat, and I'm sure he'll answer them while he's here. Or any other questions for anyone or any of us that you might have, just fire away.
I would also add to this that if once you do become a prison pharmacist, it is very, very easy for you to jump sectors. So in my life, since I became a prison pharmacist, I then went on to become the lead pharmacist. From the lead pharmacist, I was able to work as an academic pharmacist, working 2 days a week, teaching non-medical prescribing after doing my prescribing course and my prescribing qualification within the prison world. And since then, I've been able to work in a hospital, GP land, shop, and now I'm within community healthcare services, running around seeing elderly, unwell patients at their own homes. So you can easily jump and switch sectors and then go back into it because there's always places available. So I'm still supporting a few prisons alongside this NHS England role that I have for the whole of the South, but I visit a few and go and work in some still because I just can't get rid of the bug that I've got of working in one. It is literally unreal. Like Laura said, no 2 days are the same. It's jokes.
I guess also to kind of add from that, just from my experience with like applying for jobs and stuff now for the future, all they want to talk about is like the prison placement. It's such like a unique experience, and like they just love talking about it.
Think about it, guys. There's only 100 odd pharmacists in the whole of the prison world, right? In total, and how many pharmacies are on the register? Not everyone has the opportunity to go in one and see what's up.
There's a couple of things that cropped up when Laura and Rue were talking that I hadn't mentioned that I just thought we'd mention in case people are worried at all. Prison clearance. I know we've talked about how difficult it can be to get prison clearance. Part of mine and Rue's job is going to be, once we know all the 18 individuals that will be going into these, will be applying for clearance in advance. And the way that Oriel works is that you find out in December where you're going to be, and then it's not going to be until August, September time. So we have a long time to get that done. So that'll be included in the pre-employment checks that you'll be doing.
And the free outcome of that is you'll be nationally cleared. So you can literally ring up a locum agency as soon as you qualify and go, I'm nationally cleared to work in any prison in the country. Please find me a job. And you will get a really nicely paid job quite easily. Might have to travel a bit though, but there are perks to this.
And then Laura's talking about how you're doing your independent prescribing at the moment. And I know current students might be worried that people behind them are very soon going to come out qualified as independent prescribers. But there's Health Education England are supporting significant amount of funding for pharmacists working within health and justice to do their independent prescribing course. That you won't have to pay for, or your employer won't have to pay for. And so there'll be plenty of opportunities for you to do the course once you're qualified. So don't worry about the people that are behind you catching, having skills.
And an abundance of DPPs. You will literally have the pick of the bunch. Honestly, I had there was 4, which was amazing. Absolutely brilliant.
Lee, your question about being a British citizen, I don't think it impacts. If you're a pre-reg student, you're a trainee pharmacist, pardon my language problem. But it doesn't have an impact. As I said, there's a very, very comprehensive security protocols that you have to pass. And once you're cleared, you're cleared. Also, how do trainee pharmacists keep up with revision for their registration exam? So that is a very good question. So in terms of how this whole thing works, what mine and Dan's role is to find people. We're like, basically, are you able to do it? Here's somebody that has a student that would do it. And then between the host organization and the prison organization, both those individual organizations would have actually drawn out a map for you to say, week 1, we're doing this, week 2, you're doing this, week 3, you're doing this. And they would, between them, agree the competencies in which you have to achieve while you're within that 13-week placement. Furthermore, because it's 13 weeks, which is close to 3 months, and you leave your mandatory training dates from HEE that you have to attend, all of these things would have been taken into consideration when the initial plans get developed. And yes, they will ensure that there is enough scope for you to be able to have your revision time, do the other things and all the other bits. So I hope that addresses that query.
In terms of the British citizenship, on Oriel, it'll say if the placement is going to sponsor, well, is going to do sponsorship. So have a look in. All the trust ones will. The majority, some of the community pharmacies may or may not. But on Oriel, it'll say, are they doing sponsorship on there? So that'll do that. And then I guess, Amar, maybe you could help us answer the about revision and training while you've done the.
Yeah, I think it's just important to be proactive. So I think a lot of the time it can be difficult to get like, the prison that I worked at did have internet access. The only thing I kind of struggled to access was like the blackboard that I was using through UEA. But otherwise, you have access to like the BNF and all those kind of things. Stuff like On Track and stuff was still working. And yeah, I think I just used to take books in. So I had like the pharmacy questions book or just a set of questions and stuff I used to print off. And yeah, I was given like adequate time, a lot of times in the afternoon when it like quieten down a bit. Or if there's like any like a break or a gap, kind of used to just quickly like do some questions and stuff. And like it was fine, like it did help.
The other thing I wanted to add was we spoke about the whole independent prescribing thing, right, and how HEE supports that. HEE don't only support independent prescribing, but all forms of further continual professional development. So yes, I did my IP within the health and justice world. They didn't only pay for that, they also paid for a diploma for me. So I hold a diploma in pharmacy practice at DMU. And again, that was funded through HEE. So prison world pharmacists are really well looked after by HEE and are included in everything. So any sort of training, continued professional development, all fees are paid for. Don't have to worry about it. It's just when it comes through, but it's always there. So I thought I'd add that bit in there as well.
There's no more questions in the chat box. I've ticked everything that I wanted to mention. I'd say thanks to Laura, thanks to Omar for joining us. Olivia, anything else that you want to add before we let everyone go and have something to eat or go to sleep or do some revision or whatever it is that they're going to do?
Yeah, so I guess just thank you everyone for coming. Thank you for giving up a Wednesday evening. I hope you found it interesting. I've obviously already gone through the Oriel process, but I think if this had been available back when I was doing it, it definitely would have been something I applied for. I think it sounds like a really interesting sector to be a part of, most definitely. So this event has been recorded as well. So if any of the attendees have got any friends that weren't able to make it, it's going to go up onto our YouTube channel. So if there's anyone that you know that's interested in the sector and couldn't make it tonight, then they can view it on the YouTube channel. But thank you all for coming. That's everything for me.
Thank you. Bye.
Thank you.
Bye, everyone.
See you later.
Laters.